Hello everyone, in this video we are going to talk about early identification and intervention. Early childhood education is a key element for the growth and development of every country. So, special needs children should be identified as early as possible by parent in the home and later by teachers in the school. Early identification is important for the following reasons. Early diagnosis of children's needs and difficulties, obtaining appropriate aids and equipment for such children, better exposure to education, better psychosocial adjustment, and better achievements of special needs children. Let's go to the meaning of early identification. So, early identification refers to a parent, educator, health professionals, or other adults' ability to recognize developmental milestones in children and to understand the value of early intervention. However, if these problems are solved at an early age, it minimizes developmental risk and enhances child development. Moving further with the early intervention. Early intervention means identifying and providing effective early support to children and young people who are at risk of poor outcomes. Early intervention is an important step for helping the children with special needs towards fulfilling his or her full academic, emotional, and social potential. Early intervention can take different forms from home visiting programs to support vulnerable parents to school based programs to improve children's social and emotional skills to mentoring schemes for young people who are vulnerable to involvement in crime. While some have argued that early intervention may have its strongest impact when offered during the first few years of life. The best evidence shows the effective interventions can improve children's life chances at any point during childhood and adolescence. Let's take an example of a boy for understanding the importance of early intervention. A 9-year-old boy studying in grade 4 in a school, he was a friendly boy who enjoys watching television and playing with his sister at home. In class, he was an average student, lazy, slow in his work, and showed difficulty in reading and comprehension. He has an elder sister studying 7th standard in the same school, but she was good in academics. So, his teacher and parents often complained about his poor academic performance. But his parents are very supportive and they send him outside for evening classes where he is helped by the coaching teacher. In contrast to academics, he was very much interested in extracurricular activities such as basketball, athletics, running, and dancing, and has won many prizes. The case of this boy clearly shows that he looks absolutely normal and he is intelligent too. Yet he is unable to achieve the academic targets. This is why we call this specific learning disabilities. He was diagnosed with special learning disabilities predominantly in reading. After being identified, he was given structured intervention to improve his academic skills. With the support of remedial intervention, he has shown overall improvement in all the areas of academic skills such as reading, comprehension, and writing performance. Children with special learning disability need a lot of modified teaching methods to learn academic skills and perform class activities. So, it is essential for teachers and parents to understand the children's problem rather than forcing them to score high marks in their examinations. Now we look at intervention strategies for specific learning disability. Number one, response to intervention. It helps early identification of students who are at risk for learning problems. Result-based interventions are conducted and closely monitor the students with learning difficulties through three-tier systems as follows. Number one, within classroom instruction and quality teaching. Number two, pull-out sessions or small group instruction. And number three, individual support or intensive special education. Next point is multisensory reading approach. Multisensory reading method is used to teach reading skills through visual, auditory, kinesthetic and tactile stimulation. The following are two approaches that emphasizes a multisensory reading approach. First one is Fernald method. It is otherwise known as VAKT, visual, auditory, kinesthetic, tactile or whole world approach, which involves 4 stages. Students select a sight word in a flashcard. The student traces the word with his finger and is instructed to say it aloud as it is traced. The student repeats this process until the word can be written as a unit from memory. Each word that the student learns is filled in a word bank and these words are used while writing. Second is, it is the same as stage 1 except the tracing. Third is, flashcards are not used. And fourth is, the student is encouraged to learn new words from a reading passage and learn them. Next approach is Gillingham Approach. Letter sound association is taught to the student by the teacher using flashcards. It is also called the phonic method. Once the student masters letter sound recognition, he is expected to say the sound of the letter when the teacher shows the flashcard with a particular letter on it. In the same way, the student is expected to give the name of the letter when the teacher makes the sound of a particular letter without the card being exposed. The letter formation is explained to the student. Then the student traces, copies down, writes from the text, from board and finally from memory. After learning the sounds of vowels, consonants and blends, the child learns to sound out words by combining sounds and blending them into words. Thus, the child learns to recognize unfamiliar words by associating speech sounds with letters or groups of letters. In addition, phonics instruction includes a list of rules introduced at various stages. Next strategy is Busser's reading approach. A Busser series systematically parents reading skill in word recognition, comprehension, word attack, and vocabulary. The teacher's lesson includes skill objectives, lesson activities, new vocabulary word activities, and questions for assessing comprehension after completing each lesson. And the student's workbook provides various activities that aid in learning word attack skills, developing comprehension and increasing reading speed. Next strategy is linguistic approach. The words are selected on the basis of similar spelling patterns such as consonant, vowel, consonant words, that is cab, lab and tab. The child must learn the relationship between speech sounds and letters. The child is not taught letter sound directly. He learns them through minimal word differences. Words that have irregular spellings are introduced as the child progresses, and he learns them as sight words. After the words are learned in the spelling patterns, they are put together to form sentences. So, in this way, we have seen early identification and intervention. Thanks for listening.